It's January 2025, an operating room in Austin, Texas. A woman is lying unconscious on a table, cancer surgery. Her surgeon is hours into one of the most delicate procedures of the week. Monitors beeping, team focused, everything going according to plan. Then a nurse walks in, not with an update, with a note. The patient's insurance company is on the phone. They want to talk to the surgeon. Right now. Not tomorrow. Not after the surgery. Right now. While the patient is still under anesthesia on the table, the surgeon scrubs out, steps away from her patient, picks up the phone, and the person on the other end. They want to know why this patient needs to stay overnight. After major surgery, the surgery itself had already been approved, but someone at the insurance company decided the recovery hadn't been. That surgeon posted a video about what happened. It went everywhere, millions of views, because it confirmed something millions of Americans already felt in their gut, that when it comes to your health, someone else is making the decisions, someone who's never met you, never examined you, someone who works for a company that made $447 billion last year. That company is UnitedHealth Group. And this is the story of how one corporation quietly built an empire that touches almost every part of American healthcare: the insurance, the doctors, the pharmacy, the data, all under one roof. And here's the question nobody's asking: if the same company that decides whether to pay your claim also employs the doctor who treats you and runs the pharmacy that fills your prescription, who's actually looking out for you? But to understand how it got this big, you have to go back to Minnesota, 1970s, a time when most Americans paid for healthcare the old way. You got sick, you saw a doctor, you got a bill, and it was getting expensive, fast. Healthcare costs in the United States were doubling every decade. Families were going broke from hospital stays, and nobody had a fix. But one guy thought he did. He'd been working at a think tank called Interstudy, a small outfit in Minnesota, run by a doctor named Paul Elwood, the man they'd later call the father of the HMO. The idea was simple. Instead of paying doctors every time you walked in, what if you paid a fixed amount each month? A membership. The doctors get a steady income. The patients get predictable costs. Everybody wins. His name was Richard Burke, and he didn't just study the idea, he built it. In 1974, he founded a tiny company in Minnetonka, Minnesota, a suburb outside Minneapolis, population 50,000. He called it Charter Med, a claims processing operation, just handling paperwork for local doctors, nothing glamorous, nothing that looked like a $500 billion empire. 3 years later, he renamed it United Healthcare Corporation. And then he did something that would define the next 50 years. He started buying HMO after HMO, city by city, state by state, small regional health plans that served a few thousand people each, absorbed into one company. By the late 80s, United Healthcare was managing health plans across the country. Burke stepped down as CEO in 1987, pushed out after doctors accused him of having a conflict of interest. He was running United Healthcare and Minnesota's largest HMO at the same time, but the machine he'd built, it was just getting started. Now here's the thing. What Burke built was a health insurance company. That's what most people still think United Health is: an insurer. You pay your premium, they cover your care. Simple. But somewhere along the way, the company stopped being just an insurer and started becoming something much bigger, something most Americans have never heard of, even though it might already be running part of their life. Because in 2011, United Health Group created a new division. They took their pharmacy services, their data analytics, their technology platforms, and bundled them together under one name: Optum, a name most people can't even place. Ask your neighbor if they've heard of Optum. Blank stare. But Optum now generates over $250 billion in revenue. By itself, it would be one of the largest companies in America. And that was just the beginning. Optum started with data, mountains of it, every claim filed, every prescription filled, every doctor visit logged, decades of information about how Americans get sick, how they get treated, and how much it costs. UnitedHealth had been sitting on all of it. Now they had a machine to use it. Optum Insight sold that data and analytics back to hospitals and providers. Think about that. The insurance company was selling information about you to the people who treat you. OptumRx became one of the three largest pharmacy benefit managers in the country. A PBM is the middleman between you, your pharmacy, and the drug manufacturer. They negotiate prices. They decide which drugs your plan covers. They build the formulary, the list of medications your doctor can prescribe without a fight. They set your copay, and they collect rebates from drug companies for putting certain medications on that list. Most Americans have never heard the term pharmacy benefit manager, but a PBM touches every prescription you fill. And then they went further. Optum Health started buying doctors' offices, not a few, not a dozen, thousands, surgery centers, urgent care clinics, behavioral health practices, primary care groups from California to Massachusetts. In 2017, Optum acquired Davita Medical Group, one deal, thousands of physicians. In 2018, they bought Reliant Medical Group, the largest independent practice in Massachusetts, gone, absorbed by 2017. Optum accounted for 44% of UnitedHealth Group's profits, not the insurance arm, the services arm, the part nobody talks about. Now, remember that number, because it's about to get much bigger. In 2020, UnitedHealth acquired a company called Navi Health, a post-acute care management firm. Navi Health had built an algorithm, a tool called NH Predict. It estimated how long patients should need recovery care after surgery or hospitalization, how many days in a nursing facility, how many home health visits. The idea made sense on paper. Use data to predict recovery times, help patients get the right care at the right time. But here's what happened in practice. A class action lawsuit filed in 2023 alleged that UnitedHealth used that algorithm to systematically cut short recovery care for elderly patients on Medicare Advantage. The lawsuit claimed the tool had a 90% error rate. 9 out of 10 denials that were appealed got overturned. 90%. And yet, the system kept running. Because only a fraction of patients, roughly 0.2%, ever appealed. Most just paid out of pocket or went without care. The lawsuit alleged UnitedHealth knew the error rate and kept using the tool anyway because the math worked in their favor. UnitedHealth says the algorithm is a guide, not a decision maker. The lawsuit says otherwise. A federal judge recently ordered UnitedHealth to turn over internal documents about how the tool was used. That case is still moving through court, but the acquisitions didn't stop there. In 2022, UnitedHealth bought Change Healthcare for $13 billion. Change Healthcare isn't a hospital. It isn't a clinic. It's the digital pipeline, the invisible plumbing behind American healthcare. It processes insurance claims, connects doctors to insurers, handles billing for pharmacies. If you've ever had a medical bill processed in America, there's a good chance it went through Change Healthcare's systems. One company now owned the insurance, the doctors, the pharmacy, the data analytics, and the claims processing pipeline. In February 2024, that pipeline was hit by a massive ransomware breach. Hackers infiltrated through a remote access portal that didn't have basic two-factor security, the largest healthcare data compromise in American history. 190 million Americans had personal health data exposed. Names, addresses, social security numbers, medical records, insurance details. UnitedHealth spent over $3 billion responding to the breach and paid a $22 million ransom to the hackers, $3 billion, to fix a vulnerability in a system they'd just bought. And through all of this, UnitedHealth kept growing. 2023 revenue, $400 billion. 2024, $400 billion more. By the end of 2025, $447.6 billion. To put that in perspective, that's more revenue than all but two companies in America. Only Walmart and Amazon are bigger. UnitedHealth is the third largest company on the Fortune 500. One company, 390,000 employees, 50 million insured Americans, 90,000 affiliated physicians, 2,700 subsidiaries, and in 2024 alone, they quietly acquired or created more than 250 new subsidiaries. Most of those deals never publicly announced. Surgery centers, physician groups, data firms absorbed one by one under the radar. Now here's where it gets personal. Let's trace the money trail. You have UnitedHealthcare insurance. You go to the doctor. There's a decent chance that doctor works for Optum, same parent company as your insurer. Your doctor writes a prescription. That prescription gets filled through OptumRx, same parent company. OptumRx decides which drugs your plan covers. They negotiate the price with the manufacturer. They set your copay, same parent company. Now say you need a procedure. The claim goes through Change Healthcare for processing, same parent company. And if that claim gets denied, the company that denied it also employs the doctor, also runs the pharmacy, also processes the claim, also controls the data that inform the decision. Every step, one company. A study published in Health Affairs in late 2025 found that UnitedHealthcare pays Optum doctors 17% more than it pays non-Optum doctors. In markets where UnitedHealthcare controls at least 25% of the market, that premium jumps to 61%. Why does that matter? Because there are rules called medical loss ratios that cap how much profit an insurer can keep from your premiums. 80 to 85 cents of every dollar you pay must go toward actual medical care. But if an insurer pays its own doctors more, that money stays inside the company. It looks like medical spending on paper, but it's revenue flowing from one pocket to another. The Department of Justice opened an investigation in 2024. They are looking at whether UnitedHealth's structure lets it sidestep the very rules designed to protect you. UnitedHealth confirmed the investigation in July 2025, and in 2023, data showed UnitedHealthcare denied about 1 in 3 in-network claims on the marketplace. 32%. The industry average was 16. That's double. Now, to be fair, UnitedHealth says it approves 90% of claims on an initial submission, and by 2024, the marketplace denial rate dropped to 20%, still 1 in 5, but lower. The question isn't just about numbers, it's about architecture. When the same company insures you, treats you, fills your prescriptions, processes the claim, and decides what gets paid, you're inside a closed loop, and the exits aren't clearly marked. So let's make this about you. Do you have health insurance through your employer? There's a real chance UnitedHealthcare is involved. They're the largest private insurer in the country, more than 50 million members. Have you ever had a claim denied, a procedure delayed, a prescription switched to a cheaper alternative? There's a system behind that decision, and you probably never saw the name Optum anywhere on the paperwork. But here's what hits different. That surgeon in Austin, Dr. Elizabeth Potter, she posted about what happened because she was frustrated. She'd performed over 500 cancer-related surgeries. She knew what her patient needed, and she felt powerless against a phone call from an insurance company during an operation. After her video went everywhere, UnitedHealthcare sent her a legal notice. She said they were trying to silence her. They said her claims were false. The hospital stay? They said it had been approved. She said it was denied. What's not in dispute is that the phone call happened. A note was carried into the operating room. while a patient was unconscious on the table. And then something happened that changed the conversation entirely. December 4th, 2024, 6:45 in the morning, Midtown Manhattan. UnitedHealthcare's CEO, Brian Thompson, was walking toward a hotel. His company's annual investor conference was about to begin. He never made it inside. A gunman approached from behind. Thompson was shot on the sidewalk. He was pronounced dead less than 30 minutes later. The suspect, Luigi Mangione, was arrested days later. His trial is happening right now. The words found on the ammunition reportedly read, delay, deny, depose, a phrase associated with how insurance companies handle claims. That moment didn't create the anger. It revealed how deep the anger already was. Comment sections, social media, dinner tables, millions of Americans watched the news. And the reaction wasn't what anyone expected. We're not here to justify what happened. What happened was a tragedy, but the public response told a story of its own, about a system that had been frustrating people for years, quietly, denial by denial, letter by letter. The next time you get a letter saying your claim wasn't approved, ask yourself who made that decision, and then ask who profits from it. Now, to be fair, United Health argues that integration improves care, that having data, doctors, and pharmacy under one roof means better coordination, fewer redundant tests, faster treatment, lower cost over time, and for some patients, that might be true. Optum employs thousands of physicians who chose to work inside that system. Many of them believe it helps them deliver better care. The company serves 148 million people across all its businesses. That kind of scale doesn't happen without providing real value to real patients. And they are not the only ones building this way. CVS owns Aetna and a pharmacy chain. Cigna owns Express Scripts. The entire industry is moving toward vertical integration. United Health just got there first and built it biggest. But scale creates power, and power without transparency creates something else entirely. When the same company insures you, employs your doctor, fills your prescriptions, processes your claim, manages the data, and decides what gets paid, the question isn't whether that system works for the company, the question is whether it works for you. Remember that surgeon? It's January 2025, an operating room in Austin. Her patient is unconscious on the table, and a note gets carried through the door. The insurance company wants to talk, right now. She didn't want to leave that room, but she was afraid of what would happen if she didn't. That's not a glitch in the system, that is the system. $447 billion, 50 million members, 90,000 doctors, 2,700 subsidiaries, one company, follow the money, see the system. If you enjoy this video, hit that subscribe button and like the video, and I will see you in the next one.